Okay, excellent. I think we've got over 100 people who have joined, so I'm going to make a start, I think. Yeah, afternoon, everyone. Thank you very much for joining us for the latest YJB research webinar. My name is Jordan Rehill. I'm Head of Evidence and Insights at the YJB. And this afternoon, we'll be discussing the evaluation of the Prevention and Diversion Assessment Tool, otherwise known as the PDAT, which is the acronym that we've gone for. I guess before we start, it's probably worth reflecting on, how we got to this point. And I think it's been nearly 2 years. Tracy will nod, if I've got that right.
I think probably longer than that. Yeah.
I think since we got the final bit of feedback from some of those early adopter sites on the first version of the PDAT. So this publication is a really good point, I think, to pause on the tool itself, but also I guess it's how it's been embedded and used in practice. And I think we know from a lot of recent research on the implementation of Child First that there's still some tension, I guess, between the values and then the systems themselves. And by that, I mean that the values and understanding of the evidence base around Child First is pretty much embedded across practice, but some of the tools and systems are not quite there yet. And I think this tool, PDAT, I think shows the YJB's ongoing commitment to the nuts and bolts of the system, ensuring that the Child First evidence base is embedded. So we've got around an hour and 20 minutes for today's session. You'll see the agenda on the screen there. We'll begin with a bit of an introduction from my colleagues Tracy Green and Richard Vaughan, who are, they'll hate me saying it, the sort of architects of the PDAT from the YJB side, and have led on a lot of the development and the embedding of the tool. We'll then move on to Dr. Angela Collins and Madeline Morrison, who were commissioned by the YJB from Cordis Bright, who led on the evaluation, and we'll touch on the evaluation findings and what we can learn for future tool rollout. And then what we've done is we've intentionally left quite a bit of time for Q&A at the end. But we'll be quite flexible about this. If everyone's got a lot of questions, a lot of responses, we'll keep this open. But if people just want to listen in and not offer a lot of questions, that's fine, and we can leave that a bit early, so we can be flexible there. What I would say is that the chat is open. Do just drop your reflections, your questions into the chat, and then I'll pick them up in the Q&A section. And if people want to speak directly to the panelists, they can do by raising their hands in that section. But I'll remind you of that then.
Okay, Jordan, I think you've frozen. Jordan, we didn't catch the end of that. I think you just frozen for me. Were you handing over to me? Yeah?
Yes, I was. Sorry. Okay. Yeah, Teams. Classic.
All right, no problem. Right. Hi, everybody. I'm Richard Vaughan. I'm head of the East of England for the YJB. And as Jordan has said, myself and Tracy, he, very generous, said the architects, but I think we very much like to say we were the sort of facilitators of this piece of work in bringing together all the practice that was out there into one consistent and one tool. If we look at the sort of history of this, and I'm going to talk about the sort of backgrounds and why we took on this piece of work and why the sector was asking for this. Tracy's going to talk about what we did, and then our colleagues at Cordis Bright, Angela and Madeline, will talk about the evaluation and what they did. So just to set some background, as I said, and we really want to emphasize that this assessment tool was developed in consultation with key partners. And I think the key partners we were working with youth justice services, practitioners, operational managers, and people who were working with children. We also work closely with academics, particularly the ones coming from the Child First academic and evidence base, and we also work closely with the inspectorate as well. So we really appreciate all that contribution all that knowledge that went into forming this assessment. If we look over the past 10 years, there has been significant change in kind of the youth justice system in terms of first-time entrants and children entering the criminal justice system, and that you can see in our annual statistics, and I think the most recent set of statistics was published a few days ago. There's been year on year a reduction in first-time entry, children entering the criminal justice system from youth caution, youth conditional caution, and above. If we look at the figures there, we can see 10 years ago, over 24,000 children, first-time entrants coming into the justice system. The more recent YJB annual stats looks at just over 8,000. So we can see there's a big reduction in the amount of children coming in the system. And that is about the expansion, the success, and the work that partners, youth justice services have been doing in terms of prevention and diversion. And there was a need and a kind of a request for a more appropriate and a more proportionate assessment tool that could be used for this group of children. A lot of services had developed their own. A lot of services were taking on key theory and evidence bases in terms of developing those tools. A lot of services were coming from sort of trauma-informed background, child first, coming from a sort of systemic social work, family-based and identity-based sort of approach. And some areas were using those sort of child safeguarding models like signs of safety. But there was a request to kind of bring all that together into one standard tool that was proportionate and appropriate for this group of children and represented their individual need. There was also some key changes and developments in practice. The approach of sharing the assessment with a child as a process of engaging with them and them having ownership and seeing themselves in the assessment, and therefore a need that language and approach was accessible, and again that it was appropriate and proportionate to what the reasons were for them coming into contact with the youth justice system. So what we wanted to do, and we had like 4 main aims, was to standardize the assessment for children involved in prevention, diversion and youth justice services, standardize that in a way where we took the best practice from services, where we looked at outcomes of inspection, where this group and this cohort of children were within that criteria. We also wanted to promote practice and an alignment with a child first decision making and assessment framework and incorporate the 4 tenets of child first within that. So what that looks like in operational delivery and work with children. We wanted to support consistent and proportional assessments between all youth justice practitioners and all, so there was consistent assessment with any child that came into contact with a youth justice system. And also not the key purpose, we assess children to establish need and establish their strengths, but the other thing we would get is sort of a national level oversight of these children and the sort of context, themes and needs that they have, so we could represent those. Within the traditional sort of key performance indicators, we had first-time entrants, reoffending and custody. So it was only children above youth caution, youth conditional caution. So therefore, we want more oversight of the numbers and all the work that youth justice and partners are doing with those children, because it is very successful, and we want to evidence and identify what is working there. I'm now going to hand over to Tracy, who's going to talk about what we did and how we did it.
Yeah, thank you very much, Richard. Jordan referred to us as the architects. You use the facilitator. I like to refer to us as the conductor, who brought together all the kind of beautiful instruments that can play together. So having recognised the need for an assessment tool, we did a call out for examples of existing tools from across the sector, and we got over 40 different examples of different tools that people were using in the out of court space. We then cross-referenced those tools with HMIP findings to see which areas had scored well on previous HMIP inspections, and also previous HMIP recommendations, but also how those tools aligned with the child first evidence base, to see how they fitted with that. We then held a number of workshops across England and Wales to ascertain what the sector wanted from the tool. So we asked about the length of the tool, whether you wanted counter signature or not, how you wanted the format to be, what kind of questions would be useful in the assessment tool. And we used that to base the development of the assessment tool that you've got before you now. When we did this work and reaching out to the sector, we saw some really excellent practice that was being used in practice and working with children currently. So examples of that would be the use of the social graces and how that was being used to engage and understand children's needs. Also assessments being trauma informed, and the practice of writing the assessment to the child and what a difference that made to make the child much more central to that assessment process when we saw that. So we've tried to use much of that in either the guidance or the assessment tool, and those services that helped us on those early days, and we've pulled in that excellent practice. We really hope you can see the footprint of that work in the assessment tool as it exists now. So having developed the first draft, we shared that with the range of services, all those people that attended the workshops, and strategic partners for their feedback. This included academics, HMIP, the Centre for Justice Innovation, turnaround teams, and key members of the youth justice community. We used that feedback to shape and develop the assessment tool. The final version that you got last year was released to the sector, and that was version 7, with a lot of other smaller changes. So you can see that the process was a really iterative process where we were continuing shaping and developing the assessment tool based on feedback. We also took feedback from the pilot sites and the early adopter sites, and we really couldn't have developed the tool without their assistance and feedback. So we're really grateful for services that were prepared to take that on and do that piece of work. So we're really happy for the constructive feedback that they provided in terms of how we could make this tool work for all children in this space in youth justice. So when we were developing the tool, a number of the sites suggested that training and detailed guidance would be useful. So we actually set up a subgroup to look at this, and we had input from the sector in terms of what the training should look like and what the guidance note should look like. And some of that, during that process, it was agreed it would be useful to cover the core principles of assessment rather than just talking through the tool. And services could also nominate who they felt were the best people to attend. And that was really the driver to the training programme that we developed, that we then rolled out across the country. Guidance notes were also developed, which provided more context to each question in the tool. Feedback on this was provided from the sector, and we also then developed a QA tool, which really it can be used as a kind of mini guidance notes, as it acts as a summary of the guidance notes, and is probably easier accessible. The tool has been written so it can be completed with the child. So the early intention was never to have a self-assessment tool, but actually feedback again from the sector said that would be useful. And so this was also created along with a parenting self-assessment tool. Both of these tools are available on the Resource Hub, along with all the other documents that are needed to help with the writing of the prevention and diversion tool. Following the training, we did continue to support each region with 2 follow-up sessions. These were designed as a check-in and were incredibly useful to gather feedback on how the implementation was progressing and identifying any issues that we could assist with. And it was also most useful as a peer learning for youth justice services. We continue to respond to feedback. So some of the feedback we've heard is that some questions can be conflated, and we have agreed we're doing this in the next annual upgrade. There's also in the next annual upgrade clarification on the internet question, and there's going to be a new question on children who display discrimination. There's already a question on children who might have been subject to discrimination. We recognise that the My Plan, as it appears in the case management system, is not actually as child-friendly as it could be. And so we're grateful to services who have created their own more attractive, interactive version of the My Plan. And again, these are available on the Resource Hub. We continue to be grateful for the constructive feedback. It's recognised that change is difficult at times, and services have worked hard to create their own earlier version of an outer court assessment tool. We hope you can see the legacy of the previous work in the version of the prevention and diversion tool that you've got. We could not have achieved this without the help and support of the Youth Justice Services, of which we're very thankful for. I'm now going to hand over to Madeline, who's going to talk about the evaluation and the findings from the evaluation.
Brilliant. Thank you, Tracy and Richard. I'm just going to share my slides and then I will start talking. Angela, would you mind just giving me a thumbs up if you can see those slides, because I can see you. Wonderful. Thank you very much. So good afternoon, everyone, and thank you all for joining us this afternoon. My name's Madeline, and I'm a consultant at Cordis Bright, and I'm really pleased to be here with my colleague Angela, who's a principal consultant, and we've been working together on an independent evaluation of the prevention and diversion assessment tool and its implementation. I'll call it the PDAT going through this presentation. So we were really looking at what's been working, what's been quite challenging, and what does this all mean moving forward. So we were really keen to learn about the implementation process rather than just deliver a kind of audit or inspection style response to the PDAT. So at Cordis Bright, we deliver independent evaluation, research and consultancy, and we were commissioned by the Youth Justice Board around 18 months ago to deliver this independent evaluation. And as I've mentioned, we were really looking to understand how the PDAT has landed in practice rather than just to kind of do an audit job around different youth justice services. So we really wanted to understand what works in different contexts and capture lots of rich learning from people working with the tool so that it could be improved over time, but also so that learning could be translated into different contexts as well. So we weren't so much looking at the outcomes for the children who had been assessed using the PDAT, but rather what their experiences had been, and equally what the experiences had been for practitioners and managers as well. So as Tracy and Richard have already outlined, it was quite a big process and quite a big undertaking to develop and to implement a new tool like the PDAT. So a few of the core basics. I think this was introduced around April 2024, although I know it has kind of rippled out across services and there wasn't a single date when it was rolled out. It's a tool that's mandated for diversion and out-of-court resolution cases, and it's optional for prevention cases. And as Tracy and Richard have explained, it had a range of aims, including ensuring more child-first alignment in practice, ensuring more standardisation in terms of how assessments are delivered and also how data is captured. So we're using these aims that have already been outlined as the kind of basis for our exploration and our interpretation of what we heard from practitioners and children when we spoke to them about the PDAT. So I'm going to first tell you about the evaluation questions that we were looking to answer and kind of how to, I suppose, read our report and interpret our findings based on the approach that we were bringing to our evaluation. And then I'll move into some exploration of our findings, and I'll pass over to Angela to speak about recommendations as well. So what did we set out to learn in this evaluation? I'd say we had two core overarching research questions, and you can divide these into lots of sub-questions, but in very broad terms, we were looking to understand whether the PDAT was shaping practice and experience as it had kind of been intended, so whether it was starting to meet those aims that it had set out to achieve. And secondly, to take that learning from the PDAT to help inform kind of guidance or further adaptations, or just for more general learning that can be shared within the sector. In terms of our methodology, it was a qualitative evaluation, and we were really looking to take kind of rich insights from people working with the tool and experiencing the assessment tool that we could triangulate together so that we can share kind of spotlights on what's worked well, rather than generalize about outcomes that we think it might be achieving for children, and especially because we know that change takes time, and at the point at which we were doing our interviews, which was about a year ago, the services that we worked with were at quite different stages of their journey in implementing the PDAT. So just a quick note on understanding our findings. These were really a snapshot from, like I said, about a year ago, but we think that lots of the learning that we extracted should be helpful on an ongoing basis, both for the PDAT and more widely. So as I've said, different services were at different stages of rolling out the PDAT. So some, for example, were still working with a Word document version, whereas others were more fully integrated into a case management system in terms of how they could access the PDAT. And we know that lots of changes will have happened since our interviews as well. And just a note on the role that IT and case management systems have played as well in our evaluation. So we didn't set out to do a kind of technical assessment of case management systems, and that was never our aim to really explore the role that IT was playing. However, when we started speaking to practitioners, we quickly realised that it was quite difficult to separate the PDAT and the experience of the PDAT from people's systems that they were using, and the case management systems that were and are in use kind of shape people's everyday workflow and the way that they can access tools such as the PDAT. So where case management systems have played a role in people's experience of the PDAT, you will see that mentioned in our report. But these aren't kind of complaints about IT, they're sort of implementation conditions that have played a role in the rollout of the PDAT. So my last kind of methodological point is just to let you know who we spoke to. So we worked really closely with 5 youth justice services, and we're really grateful to everyone in these youth justice services who supported our evaluation. And so this brought us to a total of 52 practitioners and managers spanning different roles across these 5 different youth justice services, as well as interviews with 10 children who had recently been assessed using the PDAT. And it was really key to us that we had these in-depth conversations with children to understand really how the assessment felt to them, and whether it was supporting them to kind of engage and understand what their youth justice service involvement would look like for them. And when it came to developing our findings, we were looking for recurring themes that came up across different contexts and roles, but we were also looking for where people's experiences differed and what that told us about the conditions which kind of help or hinder the rollout of things like the PDAT. So we triangulated what we'd heard in those themes across practitioners, managers and children to kind of sense check what was coming out. And we also interpreted what we were hearing against the aims of the PDAT. So our recommendations are really framed as learning points and suggestions for direction of travel rather than a prescriptive list of things to do next. So this brings me on to the next kind of chunk of our presentation, which is about what we learned from our consultation. I'll start with what's working well and what we heard was really positive before covering some of the challenges, and then exploring that point that I've already referred to about why we think some people's experiences looked different. So in terms of positive things that we heard about, I think the headline finding that hopefully comes across in our report is that our evaluation found that the PDAT has really been important in helping to keep moving practice in a positive direction, and especially moving towards more consistent strengths-based and child-led assessment. So on the note of strengths-based and child-led conversations, we heard from some practitioners that using the PDAT has encouraged them to kind of slow down, to use tools like social graces, and to spend lots more time exploring strengths and protective factors in the process of assessing a child. And we also heard that practitioners recognise the need for a tool that supports really proportionate decisions, which are based not just on risk anymore, but really on a child's strengths and their needs. We heard that practitioners find the PDAT can enable a more kind of explicit involvement of children and families in the assessment process, and particularly when the PDAT is treated as a kind of conversation framework rather than a really prescriptive form to complete. It supported practitioners when thinking about what happens next with a young person or a child. So thinking about how their interactions with the Youth Justice Service might look and what might be most beneficial for them, as well as thinking about exit planning right from the beginning, which, as we all know, is really important when working with children. And lastly, I think a really exciting point for us that we heard about was that in some areas, learning from the PDAT had already started to spill over into other parts of Youth Justice Service life and Youth Justice Service work. So things like thinking about using more simple and kind of child-friendly language when writing plans, and thinking about ensuring decisions made around children and with children are kind of consistent and proportionate. So in summary, I think we heard that the PDAT does really support child-first practice, But some of the conditions and the framing in which the PDAT is operating can kind of interact with those positive things, which I'm going to come on to in a moment. And we also heard on the flip side of the coin about some challenges that practitioners were still experiencing when they were working with the PDAT. So we heard about some practitioners who find that there are areas of repetition within the PDAT, and that can make it feel kind of unnecessarily long, or make it feel like when they write up an assessment, they've got to copy and paste across sections because it's not exactly clear what different questions they're asking and what those different kind of threads they should be pulling on are within the different sections of the PDAT. And I think the risk here is that it can feel like it's a kind of shift towards filling out a form and taking away time from that relation building side of work with a child. And kind of connected to this, some staff describe the PDAT as feeling a bit heavy-handed. So especially for cases which might have a shorter period of interaction with the Youth Justice Service, sometimes feels a bit disproportionate to spend such a long time working through the assessment when actually they'll only have a few sessions with that child. As I mentioned earlier on, we did explore the role that case management systems have played and the way that these have affected kind of practitioners' levels of confidence with working with the PDAT, and also the time involved in working through a case management system which hasn't always felt the most intuitive. And I think one quote that really stuck with me from a practitioner I spoke to was they told me that they felt they'd moved from having a proper conversation with a child to having to carry their laptop everywhere with them because they were worried that in that initial conversation, if they didn't have the PDAT open in front of them on their laptop, they might miss a question that they needed to answer. And so this feeling that having a laptop on the desk in order to complete the PDAT has kind of detracted from that relational experience with a child. And I think what I really want to emphasize about these challenges is that I never heard anyone kind of reflecting what the tool was setting out to do or rejecting the kind of child first practice that we're trying to shift towards with the PDAT. It's really just about the systems around the PDAT and the kind of level of proportionality that have affected people's experiences with the PDAT. And in terms of why we heard some variation across the youth justice services that we spoke to, we really wanted to think about what factors are kind of helping some people in some areas to feel quite positively about the PDAT and where that feels like it's not happening so much in other areas. So I just wanted to pull out some of those factors here. So I think a few different things I heard were some various experiences about the train the trainer model of delivering the initial training for the PDAT, and particularly kind of local capacity constraints making it feel quite challenging to take so much rich learning and information back from that central training session and make sure there's adequate time in the service for diffusing that training across colleagues. I also had lots of really interesting conversations about how really strong leadership and a positive attitude to learning culture within a youth justice service has really helped some people to feel more comfortable with the PDAT. So, for example, where team meetings have dedicated space for discussing what's hard about the PDAT and what kind of challenges people have encountered has meant that problem solving has felt much easier and people have felt much more positive about using the PDAT. And lastly, I think just kind of level of readiness looks different across youth justice services. Some people were really happy with the assessment tool that they'd been using previously and didn't feel that that change was necessary because they were already feeling they were working in quite a child first way. So kind of a mixed response to having a new tool introduced. And I think these are my last couple of slides before I pass over to Angela. But it's really important to us that we are spotlighting children's experiences and understanding how their experience feels, because I think most of us here are here because we want children to have the best experience possible and the best outcomes possible. So it was really important to us that we captured this in our evaluation. So this is a photograph that came out with a consultation that I think Angela had with a child actually when we were talking about the PDAT. And I just wanted to highlight some of the things that came from those conversations with children. So lots of children that we spoke to described assessments as feeling a bit more like a chat than a kind of formal process. And they felt really positively about this. So they appreciated having a more kind of informal feel, and it really being the emphasis being on building a strong relationship with their youth justice worker and feeling that their youth justice worker was really interested in understanding them and their story and what they were interested in, what they felt they needed some support with. So really feeling like the emphasis was on them and on getting to know their own unique circumstances was really something that children felt was happening to them and they appreciated. But what also stood out to us was that the children we spoke to didn't always really understand that this was an assessment process that they were a part of. And so while they were having really positive interactions, they weren't always sure that the assessment was happening. So they'd been able to kind of open up and feel relaxed and comfortable and start that process of working with a youth justice worker. But it was slightly unclear to them kind of what the assessment meant for them, what the practitioner was trying to get out of, or how they were looking to kind of build this assessment, and what that might mean for their future involvement with the youth justice service. So we really wanted to consider this when we came to make recommendations to the Youth Justice Board. So that's something to keep in mind for what we will cover later. But I'm going to hand over to Angela now to take us through the rest of our slides.
Thank you, Madeline. Could you pop me onto the next slide? Yes, so what we decided to do was, following some of the discussions with children that Madeline has just discussed, we decided to see if we could work with some children to really understand a little bit more in detail about what would make them feel like they were more knowledgeable and kind of full participation was taken in that assessment process. Because although some children really valued the fact that it was a chat, not understanding that it was actually also an assessment and a process that they would have to go through, we thought it was important that we work with children to understand that further. So one of the things that the children recommended and that we were able to action was trying to understand what communication methods would be great for children to experience to help share the knowledge of this. So we were able to develop a short video that felt accessible and reusable across a number of contexts with a group of children who were based in a youth justice service. We worked with one particular youth justice service and a partner organisation called Close Up Research, and we held a session. If you could pass on to the next slide, Madeline. So we undertook a session. Now, it's hard to explain what these kind of sessions look like, isn't it? Because you all work with children, you know what their lives are like, you know how involved they're going to be in different activities. We decided to buy them some pizza, sit them down and have a chat about what they would like to watch, what they would like to be part of, what would help them understand what an assessment process was. So we showed them different videos, we did lots of different activities. It was a very hands-on session where we'd scripted some words and asked them to review them and would this kind of speak to them and their peers as it was something that was engaging. We tried to help them think outside of themselves and what different young people's experiences would be like and how different children would be feeling when they were in that moment where they were just about to meet a youth justice worker. What would they want to understand? Could you pass me on to the next slide, Madeline? So in helping shape the decisions about what some kind of output could be, the children told us that they wanted something that was not overtly overly official, because they up until this point that a lot of their interactions had been very formal, very official, quite intimidating. So they wanted something that was very kind and that they could feel that somebody had some empathy for their situation. They didn't want anything that was patronising or childlike. We went into this session thinking perhaps they'll want something that is kind of dynamic and interesting and cartoony, but that was definitely not what they wanted. They wanted something that kind of spoke to them on a very human perspective. We were guided by videos that they already liked, so that we asked them to show us TikToks they liked and what they were watching on Instagram, what kind of things they were engaging with on YouTube, and that discussion around those different examples brought up all kinds of different little short videos that we saw that they liked. We then worked through the script thinking about that context and the style that they like. We worked through a script trying to figure out what messages would work in those kind of stylized approaches, and the children fed back on the particular words and the framing of it and how that kind of could all be packaged together in one output. their suggestion, it came completely from them, was that they would like a current youth justice service worker to explain what was happening to them. And they thought it could work well as a conversation that they were like observing between a child and a youth justice service worker. So that's what we did. We worked with them. They kind of had a youth justice service worker in mind who they trusted and liked and thought empathised with their situation. And we involved a child in doing some of the voiceover work on that as well. And so we're going to be showing you the video at the end of this presentation. But the whole point of the video is to share widely with children and workers so that they can use it with new children coming into the service who haven't had any experience of undertaking a PDAT, and those who have, to explain what the whole process is so that they can really fully consent to their involvement and maximise the impact of the PDAT. Because if they're not entirely sure that it is like an asset-based approach that like looks to their strengths, then they may not be engaging with the PDAT in the way that would be most productive. Could you pop me onto the next slide, Madeline? Thank you. So just thinking about the overall recommendations from the evaluation, there's a lot in the report, a lot of things we suggest, a lot of discussion we have about what could be improved, what could be changed, where there's kind of nuance that can be really kind of very small subtle differences that might actually have a big change. And we've decided to bunch these between the different people. So you can tap into our report and go, right, I'm a practitioner, what's relevant for me? So you can flick through the report, look at the section, there's some recommendations there. But just taking these through the kind of starting with the Youth Justice Board. So one of the things that was really important, I think, going forward is that the Youth Justice Board remember to promote the guidance, because that's something that people really found useful to sit alongside the actual PDAT, and thinking about creating those conditions where people can have conversations, that they can have dialogue and learn about how to use the tools going forward in a way that kind of peers can talk to each other. So facilitating that that learning amongst people. For youth justice service leaders, we discuss in the report how actually embedding that learning through leadership and role modelling, that kind of approach, the child first approach, the active involvement and engagement with the PDAT, and when you're QAing responses, being really reflective in how people are using the PDAT. And we think it's really important that that happens through supervision, it happens through team-based learning. It can be a real anchor for people to discuss their practice and how they're working with children and what impact that's having. When it comes to youth justice service practitioners, one of the key things about the PDAT is it really supports professional judgment and professional curiosity. It's not there to kind of dictate the exact things that need to happen. It's there to facilitate a conversation that centres the child in all the decisions that happen thereafter. And so if that is to be the case, then practitioners have a responsibility to use that the PDAT in a way that feeds back to their supervisors, in a way that feeds back to children, that they use child-friendly versions, and we feel that that can maximise the impact of the PDAT itself. And then finally, as Madeline's covered, it would be remiss of us not to mention the CMS providers, but I think it's about making sure that those providers are a support system and that they help good practice rather than hinder it. And that's small things like responding promptly to any concerns, changing typos. It's that kind of thing that can become quite frustrating. So that's one of our recommendations around that. Could you pop me to the next one? Thank you. And so there's a lot there, isn't there? And I think we kind of thinking about this in the short term, medium term and longer term. So thinking about in the short term, what can people actually do to try and maximise the PDAT based on those kind of the notions that Tracy and Richard discussed at the beginning about what the PDAT aims to do. And so I think it's about, in the short term, making sure within the services that people are clarifying what proportionality actually is and what good looks like in relation to those forms being completed and the assessments taking place. And that would include making the guides a little bit easier to navigate, so that people can apply those lessons in real time. And again, that also fits as well to the usability and accessibility of the PDAT on the systems. Thinking about the medium term, that's about embedding all that learning. So as I mentioned previously, it's about that supervision and centering the PDAT as something to talk about practice and how people can learn from their interactions with the children, with the outcomes that happen because of involvement in the PDAT. And that can happen not only internally within YGSs, but across different YGSs as well. That was something that people were keen to have, and that's that they wanted to talk to their peers outside of their area about their lessons. And that also goes to improving consistency and targeting training for particular people, and that goes to the QAing of the PDAT, and that again leads back to leadership and role model and what good engagement with the PDAT looks like. For the longer term, we thought it was really important to take a step back and think about, right, what can be learned from the rollout of the PDAT and the evaluation that we've undertaken. And there are definitely lessons that can help inform future tools, and that's about core design from the beginning, which we've had a discussion about, but then also thinking about that accessibility and how that the learning from the PDAT can strengthen new tools going forward. And I think that is the responsibility of all those involved in the delivery and use of the PDAT. So I think that is the end of my section. There we go. I'm going to pass back to Tracy and Richard now, who are just going to talk a little bit about the recommendations and what's happened at the Youth Justice Board since we completed the evaluation.
Thanks,
Thank you.
Angela.
I think you've got a slide for this. Have we got a slide for this?
I think we have.
I will share that. Sorry, I shouldn't have stopped sharing.
Thanks,
That's
Madeline.
okay.
So we've got some recommendations, and Trace and I wanted to talk through them. Because the evaluation took place, there's been some time past. We're just sort of updating on what those recommendations are saying. So let's start. The first one was set clear standards for PDAT, the fields and the proportional use. Well, the core PDAT fields have been standardized nationally. Tracy, do you want to talk about your guidance?
Yeah, sure. So the guidance has been developed. It's on the Resource Hub. I will be updating it following the small amendments we're going to be making for next year's look at. But I urge you to have a look at the guidance. I hope it's useful. It's been developed very much for you to kind of work your way through the reasons and the theories behind what each question relates to. And there's also some resources and tools in there that you might find helpful for asking those questions. However, I do recognise it is a bit of a book, and you might not want to be reading that every time. So the QA tool that's been developed really pulls out the key points of the guidance notes and can be really used as a side-by-side guidance easy read as you're looking at the prevention and diversion tool. So originally the concentration on the QA tool concentrated on the assessment side of things, but we've also developed a QA tool for the planning side of things as well that helps structure the planning side and what needs to go in which section on the planning tool. So the resources are there on the Resource Hub. Feedback is always really welcome, so we hope you find them useful, and they're there to help you kind of guide your way through the assessment tool. I think it's probably more useful for newer staff as staff get used to it, and people have been there'll be people out here today that have done not quite hundreds but tens and tens of prevention, and you'll be well used to doing what you need to do to do the tool. But for newer starters, the guidance notes are available for you on the Resource Hub.
And the link on the Resource Hub is always the most up-to-date version of the guidance, isn't it?
Yeah.
So if you go through that link, you are always getting the most up-to-date version of the guidance. Yeah. So the next recommendation was about strengthening PDAT guidance, but also quality assurance tools. And Tracy mentioned the development of a quality assurance tool. This has been shared. In some cases, it's been embedded in the CMS, so that is available to use as you will. I understand, Tracy, some people have developed their own QAs or whatever works for them. So, you know, it's really down to local context and what works best for you and your staff. The next recommendation, we've done follow-up learning and support peer learning across services. So a lot of you be aware that Tracy and I traveled the country and regionally delivered 2-day training program for PDAT, a trainer program. And we then, since, you know, that training, we've hosted follow-up sessions regionally. So Tracy, did you want to talk to that?
Yeah, so I think these sessions have been incredibly useful. And basically what we did is we invited all the people that attended the training sessions to the follow-up sessions. Obviously sometimes there's been churn in local organisations, so people haven't necessarily been the same people at the follow-ups as would have been at the original. But each area was given at least 2 follow-up sessions where there was an opportunity to share what was working, what wasn't working, what the challenges were, but also that peer reach. We're not out there, we're not typing in the boxes and filling in the forms, but people on those sessions were, and they were really able to kind of ask each other and reach out to each other. Or how do you do da-di-da? And how do you, you know, so a simple question about how do you print from the PDAT? People were able to support each other on those. So we gave 2 sessions for every area. So Wales and England, people chose to stop after 2 sessions. They felt it was enough, which is absolutely fine. The last one of these was actually just last week. So just to show the kind of longitude of how long that ongoing support has been. So those have been there and developed. And from those sessions, because this leads me on to the next bit really, from those sessions where people have developed their own resources, we've been able to share those across peers, and there's examples of those resources that people have developed again on the Resource Hub, much more child-friendly looking plans that use the structure and the questions that are in the PDAT, and we're really keen that happens because they've been, you know, evidence-based, strength-based, embedded in child-first principles, but not necessarily appearing as child-friendly as they could do. So services who have developed their own resources, we've, you know, they're again given with generosity, and we've included those on the Resource Hub for other people to look at.
So
shall I take go on? I'll take the last one as I'm talking, but that's the only reason why I'm taking the last one. So we've heard from the evaluation team. We've also heard feedback as we've been going around the country in terms of that there's been feedback that some of the questions are a little bit repetitive. We think they ask very specific questions, but we're not going to ignore the feedback. So the new version that's been shared and will be coming out later this year has conflated a couple of the questions that we've heard are repetitive. So again, we've listened to the feedback, and hopefully you will see that in the new version of the assessment tool. But we've also picked out a couple of things that we weren't asking that we feel we should be asking. So one was the new one is about children's experience of displaying discrimination. We've asked about experience of discrimination. And there's another additional question that I'm going to struggle to remember, but there's further guidance. There's further guidance on the internet question, because the internet question asks about, does the child have access to the internet? And it can be answered yes, no, and that was never the intention. The intention was really to explore that and use that as a launch pad to talk to children about how they use social media, what platforms they're on, whether they're exposing themselves to risk through their use of social media, or even, you know, presenting a risk through their use of social media. So that question's been beefed up or veganed up, made better.
So yeah, just to support that. So you know, from those kind of follow-up sessions, from what people were telling us, we were, you know, evolving, adapting, making changes, improving, and that is ongoing. And we continue to take the sort of feedback from that, work with our colleagues within the CMS providers, your CMS providers, and develop the assessment appropriately. I think one of the things about the sessions we did was, the local context. So prevention diversion work in different areas, it looks very different, and with different people in the lead with different names and things like that. So it was really useful for us to hear about how it was fitting into those processes and those partners and all the agencies that were working. And also the locally developed resources, on the resource hub, there is specific sort of guidance on writing to the child when you do an assessment, writing to them, not about them. And that practice has been shared on the resource hub. So those recommendations we continue to take forward. We continue to listen to the feedback we're getting from the sector and improve and evolve the prevention diversion assessment. So I'll stop there.
Thank you very much, Tracy, Richard, Madeline and Angela. I think we're now going to share the explainer video, which Angela and Madeline mentioned in their presentation. So hopefully the tech works.
I'm Ryan. I'm a worker with the Youth Justice Service. If you're watching this, you've probably been introduced to your own worker and asked to do something with them called a prevention and diversion assessment. I know that sounds pretty formal, but I'm going to explain what it is and why it's a good thing.
So what is a prevention and diversion assessment?
This assessment is just a way for your worker to understand you better. What's going well, what feels tricky, and what support could help. It's not about judging you, and it's not a test. It is a meeting to create an action plan that will support you and your future.
Where does it happen?
You'll meet with your worker either at home, at school, in the Youth Justice Office, or another safe space where you feel comfortable. Your parent, carer, or another adult you trust may come along too. Sometimes, your worker might also speak separately with people who know you, like teachers or health workers, to help learn about you and build your plan.
What will we talk about?
You'll talk about different things that make up your life, like who you are and what matters to you, your family, friends, school, and health, your experience of what happened, why it happened, and what's happened to you since, and what you'd like to be different in life and how to reach your goals.
How will it feel?
It should feel like a friendly chat. If it's a long conversation, you can take breaks or do one bit at a time. To help you share your thoughts, you might use things like drawing, writing, or fidget toys. And you'll be encouraged to ask questions, speak your mind, and suggest any changes to the plan.
What happens after?
Your worker will write everything up into the plan. The plan will only be shared with you, your parent or carer, and the Youth Justice Service. The only reason your worker might share other information is if you or someone else isn't safe, and they need to help keep people safe. The most important thing, though, is that your plan is built with you, around your strengths and what really matters to you. It's about helping you move forward and have a say in your future.
Excellent, thanks, John. And that I seem to be able to watch that fine, which is unheard of for some of these meetings, which is great. I'd just like to just encourage people to use the chat again if you've got any questions. I can see a couple of them have come in as things have gone on, and thank you for people who have put links into the chat as well. But just while we're waiting for that to sort of start and questions to fly in, I'll kick off with a few questions for the panel. I guess my first one, probably for you, Tracy and Richard, but then going on to Madeline and Angela as well, is thinking about that pilot phase that I know you mentioned, and it came across in the evaluation as well. And I guess just what really came out of that pilot phase. Did anything surprise you? And did any of those sort of pilot sites help you see something that you might have otherwise missed?
I
Okay.
can start.
Yeah, Tracy's coming.
Yeah, I think that absolutely. So nothing surprised me because I was just we were both very much in listening mode. So I think probably what pleased me is, and continues to, is how receptive people were for trialing out the new assessment tool. We went to pilot sites, but we also had a number of early adopter sites. It was just like we know there's a gap, we want to try it. As we went out and looked at different practices, we came across the concept of writing to the child. It was new to me, I'll be completely honest.
Yeah.
And having seen it in practice, I could really see how powerful that was. People really gave really constructive feedback throughout. And so sometimes it might have been about how the questions were structured, or it might have been about, oh, you haven't really asked this in much detail. That there's always a balance, and it's worth saying this, and we haven't really mentioned this so far. Sometimes people want to put loads and loads of additional questions in the assessment tool. Can you have an additional question about this? So can we have additional question about whether the child is a young carer, for example? Or can you ask additional question about whether there's a parent in custody? And they're really good questions, and we really want to capture that information. But what we didn't want, and this is the balance we had to draw out really, is making it a proportionate assessment tool, but giving professional discretion to kind of capture that information in the text boxes. So there was a real balance as we walked along to try and keep the tool proportionate, but cover all the questions that people wanted asking, making sure it was strength-based, making sure it was kind of aligned with child first principles, but giving the information, the balance of you having a tool that can be used for data and information sharing and providing that whole round picture of what's happening in that out of court world for children, but a proportionate tool that's useful, meets the children's needs, is usable and doable for youth justice practitioners. So it was always a balancing act between those two factors that pushed and pulled against each other.
That's great. Thank you, Tracy. Richard, did you want to come in?
Yeah, I think, everything that Tracy said, it really helped us listen and understand what it was operationally like to use. The template is a structure of information, but it's about how it's applied to the interaction engagement with that child. I think one of the key sort of learning bits was within the assessment and within the kind of principles of child first, we wanted to change the language of risk to the language of safety. So it allowed us, working with those pilot sites, to work through that and explain the kind of concerns about the child, concerns about others, and motivation, concerns about future offending, and work through that in terms of what that means in compared to the traditional risk model used in Asset Plus. So those sort of things, it was really, really useful to work with the pilot sites and understand how practitioners were hearing that and how they were using that with children.
Thanks, Richard. And I guess just for Angela and Madeline, I know that in the evaluation, a couple of the youth justice services were obviously early adopter sites. And just whether there was anything different about those in terms of the implementation that's worth drawing out.
I think the main thing that I took away is probably you can apply in lots of different concepts, contexts, but it's that people really like to feel that they're being listened to, and especially the people delivering the thing on the ground. As Tracy and Richard have suggested, each one of us will probably design a slightly different tool that would work best for us, and people do understand that, but feeling that they've had an opportunity to kind of feed in, and it's designed with them rather than for them, I think was a really clear message that I got from speaking to people.
Brilliant, thank you. There's a question that's coming in the chat around, I mean, this is probably more for Richard and Tracy, just around the training and opportunities for more train the trainer training. if I said that right. Or is the plan just to use what they've got in-house, who did the original training? So just whether you had any feedback on that.
I mean, the quick answer is I haven't. But it's the first time we've been asked that question, so I'm going to say let us take it away.
Yeah, absolutely. But you know, Tracy and I really want to support practice, really want to support this sort of operational delivery of Child First, and also want to support taking assessment forward and how we assess all children and the tools we use in youth justice, so that they're more proportionate, appropriate, and encourage the sharing with a child, so a child can see this is assessment about them and can see these are the concerns people have, these are the strengths they see they have, that people see that are in them. I think one of the key bits of feedback we have from children who've been through the justice system or the care system, when they see their files, when they see their assessments, they say, I don't know who this is about because it's not about me. We really want to develop assessment tools that allow the child to see themselves.
That's great. Thank you, Richard. Thanks, Tracy. I had just another question, which I guess is based on the purpose of the evaluation. So when we commissioned the evaluation, it wasn't just to reflect on the PDAT itself, but it was also just to give recommendations for future tools and how they could be, better embedded and rolled out. So I guess firstly, coming to you, Angela and Madeline, I guess what were the sort of main lessons from the evaluation that you would apply to future national rollout of different tools? And then we can come to you, Tracy and Richard, after that.
Shall I kick off, Angela?
Yeah,
the first one that comes to my mind is that doing anything on such a big scale is hard and it takes time. And one thing that I certainly got from speaking to different people from different youth justice services who had been in contact with the PDAT for different amounts of time is those who were newer to it tended to feel a bit more resistance towards it, or to feel less confident naturally. Whereas I definitely had conversations with people who had worked with the PDAT for longer, and they told me, if you'd had this discussion with me a year ago, I would have been quite negative. But now that I've had time to learn how to work with it, to learn which bits I like and how I'm going to take this into a conversation with a child, I feel really happy with it and I feel really comfortable with it. So I think allowing it to take that time and to facilitate that shared learning where you say, oh, this youth justice service has got a really great child-friendly plan, let's share that across other youth justice services, and for that kind of ripple effect stuff to happen as well is really important.
I think there's also something about it being an iterative process. So like that kind of co-production, that whatever is developed, that's not the end of the story. That's not just where it ends. It's got to be that full circle of learning. And that's why evaluations are really important, to help really understand and get under the skin of it all as to where is the nuance in it, what's making people's lives difficult and what's making it easy for them and what's having the greatest impact on children. So I think making sure that that new tools are not just, it's not hard end when they're launched, that it has to be a process of learning, and that's the only thing that's going to improve the system for children.
Great, thank you. And Tracy, Richard, any reflections from you both just on future tools and their rollout?
I'll start and then I'll hand to Richard. I think we have learned a huge amount from the rollout of this assessment tool. The first thing I would say is we learned how much excellent practice there was out there that we could harness and utilize. That's one of the things we definitely learned. And actually, as I say, we're version 7.4 now. So you can see that it's been a really iterative process, responding to feedback, but also not just feedback, things that are happening in the world. So the world of children is different now than it was, let's say, when ASSET was first written all those years ago. And actually, it's not just feedback from the sector, it's feedback from all kind of academics, a whole range of other things. And this is not news, but the importance of communication and making sure people know what's happening and why it's happening, and making sure we use all our communication routes. And I think I've definitely learned a lot through that process. I'll hand to Richard in terms of anything we might want to learn moving forward in terms of any other assessment tools, or any other changes that might happen.
Well, at the moment, I know we've got in the chat talking about, you know, we have 2 assessments, also PDAT Asset Plus. People will know we've run some workshops, myself and Tracy, on some changes we can make to Asset Plus. At the moment, we've got no plans to move to a single tool. That's not to say we are looking to develop assessment with children. And as Tracy said, things change over 10 years. The approach, theory, the evidence base, and the way we're working now is different. Also, the sort of type of children we're working with, the sort of the prevention and diversion kind of group of children, and the success we've had there in keeping those children out of the criminal justice system, meaning there are less children in the system, there are less children in custody. But I think, you know, as Tracy said, a lot of learning, a lot of complexity. I think one of the things I learned was how different local delivery can be. So when you talk about prevention, diversion, out of court disposals in different areas, these are called different things. There are different processes, there are different people who lead, and you have to kind of learn from local contexts of the Youth Justice Service and their partners, and how they're delivering and how they're working with the children they need to. But you know, there's loads to learn there, and there's loads to take forward. And as Tracy said, we're on version, you know, and we will keep evolving and keep developing this assessment and other assessments.
That's great, thank you. There's a question that's in the chat here around HMIP standards, and what are the panel's reflections on how well the PDAT is enabling youth justice services to fulfil the HMIP standards. I think just before handing over to the panel, I will just put a link into HMIP's recent effective practice report on out-of-court disposals, out-of-court resolutions, which does mention the PDAT a couple of times. But I'll hand over to the panel to come back on that question.
I'll just comment.
Go on. I'm just putting something in the chat.
I think from an evaluation point of view, we didn't specifically look at how the PDAT matched the inspection framework. But I think one thing it does do is ensure that assessment and planned activity happens in a way that is child focused and child first. And so although we can't comment directly around those standards, it does enable those conversations to happen in a very kind of structured and practical way, whether that's regardless of like where the child is in the system.
Madeline, did you want to say anything in terms of the evaluation?
Angela has spoken my thoughts, so no, Richard, I'll let you carry on.
Okay. Well, you know, as I said at the beginning, you know, a key partner in this was HMIP, and we worked really closely with the inspectorate. The language of the PDAT reflects, you know, the change in language in the inspectorate as well. We really used them in consultation. They saw the assessment we were doing, and we are paying close attention to the inspection outcomes. I think we have 12 published inspection reports, and we're looking at those in terms of the how the assessment, and particularly the assessment in pre-court and prevention diversion, what the judgments are in terms of HMIP. But one thing we were very sure we did was work very closely with our colleagues in the inspectorate. Tracy.
Yeah, thank you. So we started the work on this assessment tool under the old regime of HMIP. But we knew the new standards would come in, so we worked with them, and kind of when the new standards came out, we cross-referenced the assessment tool to make sure that it meets the new standards from HMIP. So things like, you know, so we've cross-referenced the standards to make sure the assessment tool does meet the HMIP standards. Yeah. And
That's
we are
great.
seeing results from services that have been inspected and are using the prevention and diversion tool. So we know from those results that it does meet the HMIP standards.
Excellent. And Tracy, I know you've put into the chat some of the sort of local adoption of the PDAT and sort of some different resources that have been put on the resource hub. I don't know if you could speak to any of those and just talk through essentially what we've published on the resource hub already and where we encourage, I guess, innovation on the PDAT.
Okay. So the thing I've just put in the chat, because I've not been paying full attention because I can't multitask, was the guidance on how to write to the child. So that was developed by Lincolnshire Youth Justice Service. They're not the only youth justice service that are using this approach, but they're the ones that have kindly written the guidance. And I would refer people to that guidance. It's incredibly helpful in terms of getting your head round how to write to the child. We've also, so the two self-assessment tools, Leicestershire Youth Justice Service have made one of the assessment tools much more child friendly. That's the self-assessment. You can take that self-assessment and standardize it to your local service. So if you want to take that and make it, I don't know why Blackpool's come to mind, but if you want to put Blackpool Tower on it as your local self-assessment tool, so the children recognise their local area, you absolutely can do that. The most important thing is that the questions are there. But there's no requirement to use the self-assessment tool, because if you do the assessment tool in its pure original state, if you like, you're fully engaging with that child throughout. That child's voice isn't a separate thing that sits on a separate self-assessment. I've many times seen an Asset Plus self-assessment that never talks to the core assessment tool. So there's no requirement to use it, but it's there and you can adapt it. And the same with the parenting self-assessment tool. You can take that and you can adapt that as well. I have seen in the chat that the people can't find the plan in QA. I will take that away and make sure I upload. If I thought I had uploaded it, I will make sure I have uploaded it if I haven't already uploaded it, and make sure people can find that. The other thing is the My Plan. So we recognise, it's difficult to get a really beautiful My Plan in terms of sitting on a case management system, because it's a computer and it looks like a computer thing. So a number of services have created a much more child friendly, so not it keeps in line with the child first approach, but it looks more attractive, and they're on the resource hub. Clearly you can develop your own My Plan, but we do ask you to use the structure that's in the one that's in the case management system. And I know I'm not in practice anymore, so I know suggesting to double record is not going to go down well, so sorry. But actually you then have the child's version, but in an ideal world that should then be keyed into the online version as well. But yeah, again, services have given generously to share those tools with us. So keep an eye on the resource hub. It will get updated when things are updated. The tweaks that will happen in the guidance haven't happened yet because the new version isn't ready yet. So that will happen, and we'll put something out in the bulletin to let you know that there is. So we also put out in the bulletin every week what's in the resource hub, anything new. Let's make sure people know that as well. So every week, if you get the bulletin, and if you don't get the bulletin, please sign up for it. We put there's a link in there of all the new things that are on the resource hub as well, so you can have a look on there and see if there's something new on the resource hub that you think will be useful to you. Later this year is the answer to the question I've just seen in the chat. So the new version, it's not going to be fundamentally different. We're just responding to feedback from this evaluation and other feedback that we've had. So it's not going to be, it's small tweaks, the new version, but that will be coming out.
Yeah.
Fantastic. That's really helpful. Thanks, Tracy. Thanks, Richard. I guess because we're sort of running out of time a little bit now, and I think probably just in the spirit of learning and implementation and those sorts of things, I think I'll first come to you, Angela and Madeline. But I guess I know we've already talked about sort of future tools, but if there are things based on the evaluation that could have improved the rollout of the PDAT, what do you think those would have been? And then I guess I'll come to Richard and Tracy, so they're not marking their own homework when it comes to improving the rollout.
I can go first with thinking about it chronologically, perhaps, and that's in relation to training. I think one thing is that people valued the training and understood it was about a kind of a shift in approach to doing assessment. So it wasn't just a tick box, how do you feel in a form? It was about thinking about the child and being the centre. I think one of the things is people taking perhaps a much more kind of longer term approach when they're planning who goes to that training and how they're going to roll it out internally for themselves. So in that train the trainer model, it's a very you have to have someone there who can then go back and train the rest of the people. And I think that if you were to do that again, I think that would be something that the requirement of the person who goes on that training and then the requirement of them to roll that out internally themselves. I think that's just something that would be really useful in looking at, and it might get people up to speed and on board in a much more kind of fluid way, and maybe prevent some of that kind of the difficulties at the beginning of figuring out who should be doing what and why we're doing this bit, and is this mandatory, is this bit not. I think that might help, and I think that leadership is really important when it comes to that, and valuing the who's been to the training and what they've got to say about it internally at the service. That's my first point. I don't know if there's anything to add from your perspective, Madeline.
I think building on that and working chronologically, Angela, I would say following the training, and when it's actually in that kind of maybe 3 to 6 month process of really embedding into the service, really finding those times to talk about it, whether that's for practitioners within a team to have meetings where they just talk about what they're finding hard and kind of joint problem solve, or whether that's for youth justice services to link up with one another and share those resources that they're developing, or share them with the YJB so that they can go on the resource hub. I think just finding all of those opportunities, which I really appreciate, is really hard to find time for, but they're had so many conversations of people saying, oh, I didn't know that someone's doing it in this way. I'd be really interested to have a conversation with them about how they've interpreted it or how they're approaching completing this part of the assessment tool, for example. I think just all of those small reflective opportunities seem to have made a difference for people.
Well, thank you. And Tracy, Richard? We've got very limited time, so I'm going to say...
I hear everything
summary.
Angela says. I completely hear that. And my reflection would be absolutely take that on board. I think the follow-up peer sessions have been incredibly useful. It's about who's been able to attend those. I guess my last thing would say is those can continue. They don't need to be hosted by us. You all met each other at the training, so you can continue to do that peer support without YJB oversight of that. So that would be my suggestion.
Brilliant. Richard, quickly before we close.
That was our that was my observation too. But also, I mean, I completely acknowledge, we can co-produce templates and written guidance, but actually going out, training, talking, case examples, specific examples, and when Tracy and I were out and delivering that trainer, the bits of practice we heard, were just excellent, and they weren't massively resourced or expensive. They were about interactions between people and children, and they were just brilliant. So that sort of sharing and that sort of understanding was excellent for everyone, I think.
Great.
And we loved doing it.
Yeah, we did.
The most important thing. Yeah. I know that there's been some chat there's been some messages in the chat around the sharing of the PDAT with those with outside of the Youth Justice Service. I'm going to suggest, because we've run out of time, that maybe Tracy and Richard, you can come back on that outside of this call.
Yeah, of course.
Which would be really helpful. But I just wanted to say thank you so much for everyone coming along, taking the time out. Thanks to all of our great panelists. Really good Q&A. I really appreciated that. I'm going to put a link in the chat, which is basically a very short 2-3 question survey, just to feedback on both the webinar and the research itself. Safira's already done that. Thank you. But I just wanted to say thank you very much again, and have a great afternoon. Appreciate it.
Thank you.